Hi, I'm Dr. Allen from Jones Animal Hospital. Welcome to Vet Visits. Today we're going to talk about a parasite called heartworms. Heartworms are primarily a problem with dogs, although rarely cats can get them, ferrets, even occasionally, very rarely, other wildlife can get heartworms. Heartworms are carried by mosquitoes from one dog to another. The way that works is a dog that has heartworms has adult worms in their heart. Those adult worms produce baby heartworms called microfilaria, which are released out into that dog's bloodstream. Mosquito comes along, bites the dog, takes up a blood meal, takes up some of those microfilaria or baby heartworms with that blood meal. The microfilaria go through some changes in the mosquito, then the mosquito comes and bites another dog, puts those baby heartworms into that dog's bloodstream when it takes another blood meal from that dog. Those microfilaria go through some changes as they travel through that dog's bloodstream. Eventually they wind up in the heart where they mature into adult worms and then produce more baby worms on their own. The adult worms in the heart damage and damage the lungs. A dog that has heartworm disease, that is an advanced case of heartworms, will be coughing, they'll be short of breath, don't have much energy. Eventually they'll die from them. Heartworms are a fatal disease if they're not treated. Doesn't happen right away. Often it's several years from the time they're first bitten by the mosquito, but heartworms are eventually fatal. If they're detected early, though, it's a very treatable disease with a very high success rate. Requires lab work and x-rays and medication and a period of hospitalization and confinement at home, but they're a very treatable disease. Much better, though, than treating heartworms is preventing them in the first place. And currently there are some very effective medications we give. All of them are given on a monthly basis, so just once a month you have to give the dog its heartworm preventative. By giving its heartworm preventative on a regular basis, all year round, it does a very good job to prevent dog from getting heartworms in the first place. Then you never have to worry about what happens with heartworm disease. So dogs start prevention as puppies, and starting them as puppies, we don't blood test them first. It takes 6 months from the time they're first bitten by a mosquito until the test can show positive, so there'll be no reason to test a puppy. So we start puppies on prevention when they start coming in for their puppy visits. When they come in for their first yearly boosters, we do a heartworm test at that time. And very often people will say, well, why do you have to test them? I've been giving the medicine very consistently. I don't understand why you need to run a blood test to test for heartworms, but there's several reasons for that. First is there's no medicine that's perfect. Even though the medicines are very, very good, there's always a remote chance that the dog got exposed to heartworms and contracted them in spite of being on the medicine appropriately. If you're testing them early, you're going to detect it early. That's the time when it's the most treatable with the least potential for side effects. Also, no people are perfect. Everybody has schedules. Many folks have families and jobs and other animals and hobbies and things they do, and may not always get the heartworm prevention right exactly on schedule. It's been very well documented that just a 2-week lapse in not being on schedule with the heartworm prevention can provide a window where if they were bitten by a mosquito during that time, they potentially could get heartworm disease. So by testing them each year, again, you're going to detect it early if something like that happened. Also, several of the preventives that we use are oral. Well, dogs throw up. And a lot of times you don't know when the dog throws up. So if you give the dog its medicine, it goes outside to the bathroom and spits up its heartworm pill, well, then there's a whole month that it wasn't protected. So that's another situation where testing them once a year, when they come in for their annual checkup, you can detect them early, check if they get heartworms. That way you can treat them when it's the most treatable and the least potential for complications. So there's a little bit about heartworms and heartworm prevention. An extra bonus, most of the heartworm preventatives that are used now not only prevent heartworms, but also take care of the major kinds of intestinal worms, and then several of the brands also take care of flea control. So with one medication given once a month, you can have a very comprehensive parasite control program for your dog. I'm Dr. Allen from Jones Animal Hospital. This has been Vet Visits.